This is 22 News in Focus.
Welcome to 22 News in Focus. I'm Rich Teddemer. The COVID-19 crisis has directly impacted our military veterans. Dozens have died or were infected at the Soldiers' Home in Hoyoke. Others suffer from physical and mental illnesses, or are homeless, or have limited incomes. Every city and town in Massachusetts is required to have a Veterans Services officer. Their job is to provide support and resources to veterans within their communities. Today on 22 News in Focus, we'll be learning about what's being done locally to help veterans in need. And joining me for this discussion is Stephen Connor, Director of the Central Hampshire Veterans Services. Stephen, thanks for being on the program this morning. We appreciate it.
Thank you. Thank you for having me.
And Stephen had let us know that he actually watches 22 News sometimes at 4:30 in the morning. We appreciate that as well. So we're all up early, I guess, right?
Yeah.
Yeah. Let's start off with this. What is a Veterans Services Officer and what is their function?
So as you had stated, everyone in every community has to have a Veteran Service Officer. And our responsibility is to provide counseling, assistance in paperwork, and to provide primarily a benefits program offered by the state.
So what
it's
is
under the Mass General Law, Chapter 115. It's for veterans that are either low income, unemployed at the time, or a lot of folks that are on fixed income, whether it's disability or whether they're retired.
What is the differences between a Veterans Services or Veterans Affairs?
Okay, and that's a good question for me because I'm stationed out in Northampton and everybody calls and says, yes, can you get me in contact with the pharmacy? So we are not the VA. Veterans Services is a state mandated program. The only state in the union that has something like this. And it's all local and state assistance. What happens with the Veterans Affairs is that's the Department of Veterans Affairs with the federal government. They run the three programs of VA Health, VA Benefits, and the VA Cemetery. But that's all federal stuff and guided by Congress. We are guided by the state of Massachusetts and the legislature.
What kind of public information and programs do you provide in order to reach veterans who may not be aware of your services?
So that's been a struggle. I've done this for over 16 years now, and that's been one of the big difficulties and objectives of us to try to get word out that we're there. You'd think if it had been around for 150 years, people would know about us, but they still only think about us when it comes to parades and ceremonies and getting the flags out. But there's so much else that we're required to help with, like filing for VA paperwork to get disability claims in, things like that. So I've always been involved with the stand down, the Western Mass stand down for veterans that happens in Springfield every year. That's an attempt to reach as many veterans as we can. We also have other efforts. A new one that we started just a couple of years ago is called Veterans Picnic in the Park. And we find a location, invite families to come, because we've discovered over time that getting the veteran to come and get help is not always so easy. But if you get their if you get their family involved, then usually we have easier access. So every year in September, October, we've been having a big picnic with entertainment, but all the providers for veterans are in that one location. Last year we were at Speck Pond in Wilbraham, and hundreds and hundreds of veterans and their families came to the event, and it's to let them know what their benefits are and how to get them.
So when a veteran contacts you, what's the application or enrollment process?
So the most important thing, and if you ask a veteran, they're going to be able to tell you this, the most important thing we need from the veteran is their discharge papers, their DD-214. That starts with deciding their eligibility. As you had asked before, the difference between the VA and Veterans Services is eligibility. You could be eligible for our program, but not the VA healthcare system, or you could be eligible for theirs and not ours. So it's a different thing. It's set by the different governing bodies. But the most important one is getting the DD-214, and then we can start the process.
What if they don't have that document? Is there any way that you can help them acquire them?
Yes, we do that often. Sometimes it just gets lost over time. Other times it mistakenly gets thrown out. We have two sources to do it. One is qualified people who have access to a Massachusetts website. We are allowed to go in and search by name and different identifiers. And often the state, if the person served from Massachusetts and came back to Massachusetts, often they have that DD-214. We just have to go in and I can get it in a matter of minutes. If it's not on that site and somebody came from somewhere else or they never turned one in, we go through St. Louis. And there's the big archives down there, the National Archives. It's a process to get it. And sometimes it can take several weeks. But it's necessary. And once they have it, it'll be certified. And they can use it for whatever they need after that.
You had mentioned about veterans' families, and if you get the family involved, a lot of times the veteran will come too. Do you provide any services or programs for veterans' families or their caregivers?
So, yes, we assist the whole family to get services. Now, if the veteran has passed away, we are obliged and grateful to assist the surviving spouse or any of the surviving children if they're young or if they've been disabled since they were young and they're now adults. We can help them out with our financial assistance program, just like the veteran. The budget's the same, the amount of money is the same, which is very unique because the VA has different rates for whether it's the spouse or the veteran. In our case, it's the same amount. And we can help them with medical expenses, all those kind of different parts of life, and helping them file for benefits through the VA.
Wow, so it's not just the veteran, but also their families as well. Good to know. We'll continue our conversation after a short break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about resources and services for veterans during the COVID-19 crisis with Stephen Connor. He's the director for the Central Hampshire Veterans Services. Stephen, thanks once again for joining us. And during this pandemic, have you seen an increase in calls from veterans or their families, and what are their concerns?
So for us, it was pretty quiet initially after the City Hall had closed and Memorial Hall had closed. But as it got closer to the time that people were waiting on their benefit checks, we started getting more calls because they were concerned, what's going to happen if we're closed? Are they still going to get their benefits? The reality is some people live really on the edge, our veterans, and plus we have a large amount of homeless veterans that we assist, and this money is really important to them. So we got a lot of calls about that. Everything is going according to plan. We might be a day or two later than we used to be, but all the benefit checks are still getting out. But then we also get a lot of calls about the VA and how that's operating, the VA hospital, what are the limitations? So we need to know a lot, and I talk with my staff, if not every day, almost every day, all of them, to make sure that they've got the most up-to-date information to share with the people calling.
Has this national health crisis made it harder for Veteran Services officers to have contact with veterans?
Yes, because we're so used to seeing them just being able to walk into our office. They'll drop off medical receipts, things like that, and we're not seeing them. So we decided very early on that at least once a week, sometimes twice a week, we're calling most of all of our recipients that we're assisting with, or we're emailing them. But it's taken a concerted effort to do it, but we're now almost in a way more in touch with them than we were before.
So even without that personal contact, you're still getting the information out.
Yes. Yeah, we're operating another program that we'll talk about in a minute that gives us a little bit eye on eye for some of our folks.
Is that social media? Are you using that, and are veterans responding to social media and that kind of contact?
Yeah, so We do have our own social media. All of the VSOs have their own Facebook page, Twitter accounts, and often people are using those. I put on something kind of enticing once in a while to get them to get onto the site, and then I'll talk about our benefits, that we're still open. There's a whole campaign that we've been working on statewide to say, I am your VSO, kind of a hashtag I'm your VSO, to let people know that we're out there and we're still working.
Give me an idea of something that you would put out there that would make them then go to the site and check it out.
Oh, if there's some news about veterans or about the, well, for instance, anything I put on about the Hoyle Soldiers Home gets all kinds of hits of people being interested in it. And I always have something running on my page about benefits and the services that you can get. There's also just when the VA has something to announce, positive or negative, I put it on the site. And so that'll get people to go to the site and find out what's happening.
We're always talking about testing right now. Do you have access to COVID-19 testing for veterans?
So we don't per se. I mean, it's been limited all over the place, and we're no different, except that the VA does do their testing. They just have to speak with their primary. It's like everybody else. You have to have some symptom or some indication that is necessary for you to be tested, and the VA will do it.
Do we have any idea when that might not be the case, when you actually might be able to go in there and get a test just because you want one?
You know, I've asked that question. Other people have asked it. We don't know that. It's not yet anyways. Whether they come up with that test that will find out if you have the remnants of it, and that you may have had it, I imagine that's going to come full force before any of the others that indicate whether you have it right now.
Yeah, we're all waiting for that day, no doubt about that. How is the State's Department of Veterans Services supporting your efforts?
So a couple of things have happened that are really important. Shortly after this broke, we started meeting with the secretary and his staff at 600 Washington on virtual calls and even sometimes on Zoom to talk about how we're going to get our benefits out to people and make it easier. Often we have a request for the paperwork that I talked about before. Yeah, the DD-214, but we need to have their income information. We need to have their assets, bank statements, things like that in normal times. Right now, they have eased up on a lot of those requirements to allow us to assist veterans without getting all that documentation, because often that is, they have to go to their bank, they have to go to different places to get that information. And we're given more leeway to have faith in the fact that these people are veterans and that they are in need. We work in towns, which is, you know, the Department of Transitional Assistance can't do what we do because we're right there. And a lot of the people that we deal with, we know. And it's easy to say, you know, I know this veteran, there is a need, I'll get you all the paperwork later and help them out. So thankfully, the Department of Veterans Services, and that authorizes everything we do, has eased up on a lot of the regulations and requirements until a later date.
Okay, we're talking with Stephen Connor, the Director for Central Hampshire Veterans Services, and we'll talk more about COVID-19 veteran outreach when we return. You're watching 22 News in Focus. Watching 22 News in Focus. Today we're talking about services and resources for veterans during the COVID-19 crisis with Stephen Connor, Director for the Central Hampshire Veterans Services. And Stephen, what types of new services or resources are you offering to veterans in regard to the COVID-19 crisis?
So pretty much we're doing what we've always done. There's nothing outside of the ordinary, except early on we learned that one of the struggles our folks were having was, due to the pandemic, getting public transportation, feeling safe getting into supermarkets, all of those kind of things that have gotten in the way. We had to figure out how to address it. Fortunately, I got contacted by somebody from the Salvation Army, who I know, and said, you know, we're doing this emergency program of providing non-perishable food. Do you think any of your veterans would be in need? Didn't take very long for me to contact my counterparts around Western Massachusetts to find out, yes, indeed, a lot of us have that. And so we are running a program now to deliver food right to veterans in our communities.
Is that the Food for Vets program?
So that's one of them, yes. For those folks that pay attention to the Patriots and all of that, at Gillette Stadium, they worked on military, Mass Military Foundation is running a program for veterans to get these food boxes that they've assembled. They get shipped from Foxborough. One site is Agawam, where we are using at the Empowerment Center. And we're going there, getting our boxes. Any veteran can register to go there. However, our people, a lot of them are seniors or with disabilities and not having vehicles. So we'll go down, pick up a whole bunch of them, and get those food boxes to the veterans in our community. So we're using two sources.
Nice. Who are your community partners?
So the Salvation Army provides a big bulk of what we've been doing. Now we're also working with the Empowerment Center to get the other boxes because they have to wait on their donations to make sure there's enough. So we're not trying to burden one over the other. We're using both sources. I have members of the Northampton Kiwanis Club who owns a business. He has himself and his staff running down to those two places, picking up the boxes and getting them to communities where the VSO meets, grabs them, puts them in their car, and then goes out and delivers them. We're also doing that in association with the VA that runs the homeless program. They know they're vulnerable people, and they're coming and they're grabbing boxes at those drop-off sites and also delivering them. So we have Salvation Army, we've got the Kiwanis Club, we've got businesses, we've got a lot of people who are trying to help out in this time. And actually, once a week, I have a local country club that is making meals for my veterans closer to Northampton. And every week we're providing them a hot meal that's been donated by the members of this country club. They're cooked, we grab them, and we go out and deliver them with their food box. So that's the contact, the eyes on veterans that I was mentioning before. This is a great opportunity to see how everybody's doing.
Wow, that sounds like a real team effort going on right there. Congratulations on that. You mentioned the Empowerment Center. What kind of services do they provide?
So the Empowerment Center has all kinds of goods that veterans can come down different days. If you go to, I think if you Google that, you'll find it. It's down in Agawam, 104 Ramos Circle South. And they have all kinds of supplies for veterans. And like I say, they give out big food boxes, but you can also go during their other open times. They have produce, they have dairy and things like that for veterans to go and get, just to get by. So it's run by a group that's part of One Call Away, which is also located in Hampden County. So it's quite an operation, and it's really come in handy. They can also help people get connected with other services, especially they know all of us, and many times have referred people to us.
How can the community help your efforts, and do you need volunteers or supplies?
So the best way to find that need would be to call your local veteran service officer and see if you could help them with deliveries. Like I say, some places we drop off 40, 50 boxes of food, and that community now has to get it out to all the veterans. They've got volunteers. I think the Kiwanis Club of Westfield is helping, but a church group has helped. You know, so it's finding out what's happening in your community, what your VSO is doing, and seeing if you can assist with them.
As we wrap up here.
I have 11 communities. People can call me. I can always use volunteers.
Yeah, it sounds like you got it under control, and I'm sure you take all the volunteers you can get. That's very good news. What kind of advice do you have as we wrap up here for veterans who may have concerns about access to medical treatment, food, or financial help?
It's really important to know that you have a VSO in every town. And if you're not able to reach them, call the neighboring town. When it comes to the emergency food distribution, we don't care what town you live in. If you're not able to get in touch with one person, call the next town. We'll make sure you get things. The other thing with it, when it comes to the financial assistance, especially with rent and issues like that, anybody who is 200% of the federal poverty level and below are going to be eligible for our benefits, whether it's the veteran or the surviving spouse of a veteran. And there's a website that people can go to, and I think you'll have it lower on the screen. It will tell people where they can go to find out if they're eligible. But there are more people who are eligible than they think they are, and we want to help them. They just have to go to the local city hall, town hall, and reach out for the veterans agent.
Thank you, Stephen. We'll have some final words when we return. You're watching 22 News in Focus. 22 News in Focus. Today we've been talking about services and resources for veterans impacted by the COVID-19 crisis with our guest, Stephen Connor, Director for the Central Hampshire Veterans Services. Stephen, thanks for being on our program today. And that's all for our program.
Thank you very much for helping me get the word out. I appreciate it.
Nice to have you. You did an excellent job talking about your services. And thank you to you watching at home. If you missed any of it, you can watch it on our website at wwlp.com. From all of us here at 22 News, we wish you a wonderful day. See ya.